For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. We're here this morning to share an important update regarding our local health orders. And in a second, I'm going to turn it over to Dr. Sara Cody, our Public Health Officer and Director of the Public Health Department here in Santa Clara County. But before I do that, I just want to remind folks we have one broad community-based health order that's been in place since May 18th. It's related to the ascertainment of vaccination status for employees. And today we're announcing an update and phasing out of that order. I'm going to first turn it over to Dr. Cody, and then I'll come back and go through a few of those details with all of you, and then we'll be available to answer questions.
Good morning, everybody. I'm Dr. Sara Cody, County Health Officer. It's wonderful to see you and to see your faces. I forgot what everybody looked like. So today we're here with really great news, and that is that in light of the very high vaccination rates in our county, the low and stable rates of COVID, we are phasing out the last local health order that we've had here in Santa Clara County. And James will talk a little bit about those details. But because the Cal OSHA workplace regulations are now in place, our order doesn't need to stay in place. Right now in Santa Clara County, 80% of people 12 and older eligible to be vaccinated are vaccinated. 80% have had at least one dose of the COVID vaccine. Over 70% are fully vaccinated in our county, and that is tremendous. In fact, we have the highest vaccination rates of any large county in the United States. So it's a pretty safe place. Going forward, our work will be to ensure that our vaccination rates continue to increase. We especially want to ensure that communities that have historically been hard hit by COVID, places where vaccination rates are not as high as they need to be, that is where we will be focusing our work. As always, we want no one to be left behind, and we are doing everything that we can to reach those who've not yet been vaccinated, are eligible, and wish to be vaccinated. Thanks so much, and I'll turn it back over to James.
So I'll first give just a little background on how the local regulatory landscape has changed in the last few months, and I'll talk about what today's order does and what it means. So back on March 3rd of this year, the county rescinded all of its activity and industry-specific regulations, resting solely on the state's blueprint framework for things like capacity limits or specific rules and regulations related to certain activities to keep people safe. On May 18th, Dr. Cody issued a new order that eliminated all of the remaining local requirements, such as maximization of telework, the requirement to have a social distancing protocol, again resting solely on the state rules related to those kinds of issues. The one piece that was continued in place with the May 18th order was a requirement to determine the vaccination status of staff by employers and businesses and governmental entities. And that was done so that people would have the information needed in order to be able to actually operationalize and put in place the important safety rules that apply to those who are fully vaccinated versus those who are not yet fully vaccinated. In light of the new Cal OSHA regulations that took effect on Friday, these rules provide that people who are fully vaccinated generally do not need to wear face coverings indoors, except in certain settings. Again, those are the state's rules related to face coverings. These new Cal OSHA regulations eliminated the requirement for physical distancing and relaxed a number of other standards as well. But the key under these Cal OSHA regulations is that to be considered fully vaccinated, the employer must have documentation of your vaccination status. OSHA has explained in FAQs on its website that you can obtain that documentation through means such as a self-attestation, just like was provided under the county's May 18th order. We're very pleased that the May 18th order now enables businesses and entities here in Santa Clara County to immediately and legally implement the OSHA rules safely, because they will have that documentation of vaccination status. And as a result, every entity that has completed 2 rounds of ascertainment, the one initial round for all of its staff and one subsequent round for those staff who were not fully vaccinated, once a business or entity has completed those 2 rounds, the May 18th order has no further effect. If businesses or entities were doing so on time, they should have already completed both of those rounds by June 14th. And so, effective today, there's no local regulation at all. For those businesses that maybe are a little delayed in completing those 2 rounds of ascertainment, as soon as they do complete those rounds, again, the May 18th order will have no further effect with respect to that entity in Santa Clara County. Again, the May 18th order allows people to actually legally and operationally effectuate the OSHA safety rules. It is still important for folks who are not fully vaccinated to continue to use face coverings, to continue to follow the recommendations and safety precautions that are in place. Vaccination is highly effective. You heard Dr. Cody talk about the outstanding rate of community vaccination here in Santa Clara County. But there's still about 30% of eligible people who are not yet fully vaccinated. And we urge them, number one, to get vaccinated. And you can go to scfreevax.org to find out how. And until they're fully vaccinated, to continue to wear face coverings and exercise appropriate safety precautions. With that, I think we're happy to answer questions.
If you can let us know who your question is for when you ask, we'll start with KPIX.
I guess since you're at the podium, I do have a question for you. There was a fairly significant pushback from some members of the business community who felt as if they were being asked to get vaccination, please, having to require a vaccination status, and then go back to people that were unvaccinated and didn't answer the first time. If you're lifting this and you're now moving under the state's rules, if they haven't done it already, and you're not going to be involved in enforcement, why should they bother doing it?
So the question is, there was some pushback from some related to the vaccine ascertainment requirement, and what's the incentive for people to continue to complete the process in light of today's announcement? That's exactly why today's order is a phasing out. It does require entities to have completed those 2 rounds. So the first initial ascertainment of all staff, and then a second round, which is one follow-up just with those who are not fully vaccinated, which again should only be, for most folks, a small percentage of their staff. But once you've completed those 2 rounds, you need to do nothing further. If you've timely already done that, you need to do nothing further. But this is essential information to be able to implement those OSHA rules. And again, the OSHA regulations require that the employer have affirmative documentation of vaccination status in order for you, for example, to be unmasked at work.
Just a quick follow-up. To my understanding, there was never a reporting requirement. This information was never turned over to the county. So how are you going to kind of effectively figure out if businesses were in compliance to begin with?
So the question was, there was no reporting requirement to the county. How will we figure out if people have been in compliance? So first, that's absolutely correct. The May 18th order does not require any reporting to the county. We do have a complaint-based compliance system where we will follow up with entities if we receive complaints. In addition, OSHA will be doing enforcement and will follow up with entities to ensure that there's documentation. And we are requiring folks to maintain their documentation for the duration of the OSHA emergency regulations.
ABC 7.
So I feel very grateful today, and I feel very hopeful today. And that's because in Santa Clara County and in the Bay Area region, our communities took COVID very seriously. We did, and our communities did. People really stepped up, and when we asked them to shelter in their homes, socially distance, most people did. We also have had amazing uptake of vaccination. So those two things put us in really quite good shape here in Santa Clara County. I think our whole region is one of the safest places in the U.S. at this point. So that's very good news. At the same time, we are still in the middle of a global pandemic. We still have variants that are emerging. And not everywhere is as safe as we are. And there's lots of communities that still don't have the access that we have to vaccine. So I feel very grateful and very hopeful for our region. And at the same time, we will continue to do everything that we can to ensure that every last person that should be vaccinated, is able to be vaccinated, and wants to be vaccinated gets vaccinated, because that protects our community as well as the individual. And we will also, do what we can to support others. I think it's just important to remember that while we're safe here, the pandemic isn't over. And so we still need to stay on top of it. And as we have since the beginning, it's been a whole of government, whole of community, everyone working together, and it's kept us safe, and I hope that we stay safe. Thank you.
So if business in Santa Clara County has fulfilled the requirements under the May County order, are they also therefore in compliance with the state order? Do they still need to take any further actions? How do those two things interact?
So the question is, what's the interaction between the May 18th order, the ascertainment, and the state regulations? The great news for our businesses and entities here in Santa Clara County is that if you're in compliance with the May 18th order, the ascertainment order, that means you already have documentation right now on the vaccination status of your employees. That puts you in compliance with the OSHA regulation that's now in effect to have documentation for those who are fully vaccinated. So you can allow those individuals who are fully vaccinated to then work under those rules, meaning they don't have to wear face coverings except in certain settings, and other requirements like the quarantine requirements and other things also are relaxed if you're fully vaccinated. It's worth noting the state does have a few categories of exceptions where everyone does still need to wear face coverings, such as on public transit, healthcare facilities, jails and correctional institutions, schools, childcare, and youth settings, and I think I'm missing homeless shelters and emergency shelters. So those are under the state's rules regardless of vaccination status. But everywhere else, if you're fully vaccinated, your employer has that documentation, then you don't need to wear a face covering because of the vaccination. And the definition of fully vaccinated under that OSHA reg specifically uses the word the employer has documented. And so it's not just a matter of you verbally saying it. There has to be that documentation, and self-attestation works, and they've put up FAQs to that effect on their website.
Final question, Stacey?
Yeah, I have a question for Dr. Cody.
Go ahead.
From a public health standpoint, or from the beginning, it was important for us to get to 75, 80, 85% population, but that kind of confers protection even to the people that don't get vaccinated. So if we are either reached that or we're nearing that in terms of people getting their second shots, why expend any more energy kind of trying to protect people that have elected not to get vaccinated?
So the question is around herd immunity, and given that we have relatively high levels of vaccination, why keep persisting and trying to get more vaccinated? And the answer is because herd immunity in some ways is very localized. So there may be one community or neighborhood in our county where people are quite protected because even if you are unable to be vaccinated, most people you come into contact with will be vaccinated. And there are other communities in our county where that's not the case. And so people who are not vaccinated are not well protected because many of the people they will be in contact with are also not vaccinated. We know that there still are barriers to vaccination. Some people have difficulty getting off of work or making time or competing priorities with family, etc. We will continue to do everything that we can to help people overcome those barriers by offering vaccination in communities as accessibly as possible. Another issue is there's quite a bit of misinformation about the vaccine. And we want to partner with whomever we can to ensure that the information that people have is accurate and correct so that they can make good decisions. From my perspective, and from the perspective of many, many, many people, these are extraordinary vaccines, extraordinarily effective, extraordinarily safe, and the benefits of getting vaccinated vastly outweigh any risk. Think about this. We take risks every day when we get in our cars. We take risks every day when we cross the street. Everything has a risk. These vaccines have a risk, but it is tiny, and the benefit is tremendous. The benefit of the vaccines have gotten us to where we are today, where we are all standing here, seeing each other's faces for the first time and, getting back to our lives. Thank you.
But I guess my question is, if I could just reframe it, is why expend the energy or the expense to set up kind of a regulatory system to protect people that have elected not to protect themselves?
So the question is, why work hard to protect people who have not elected to protect themselves? And the reason why is because there are many people who still cannot be vaccinated because they're under 12. We need to protect them too. There are people whose immune systems don't work well because of illness or medications or what have you, who even if they're vaccinated aren't going to be protected. But we can protect them if we get vaccinated. So not everyone who is still susceptible is susceptible by choice. And that's why we need very high rates of community vaccination, and we need them in every community.
Thank you, everyone. We'll now begin the Spanish language portion of our press conference with Ricardo.
Muy buenos días, mi nombre es Ricardo Romero-Morales, soy oficial principal de información pública para el condado de Santa Clara. A la luz de las regulaciones recientes adoptadas en el lugar de trabajos emitidas por el Departamento de Relaciones Industriales de California, División de Seguridad y Salud Ocupacional, comúnmente conocidas como OSHA, el día de hoy la doctora Sara Cody, oficial de salud y directora de salud pública del condado de Santa Clara, acaba de anunciar la eliminación gradual de la orden de salud local del 18 de mayo. Las nuevas regulaciones del lugar del trabajo de OSHA no requieren que los trabajadores que están completamente vacunados usen mascarillas en muchos de otros cambios. Lo que sabemos es que las vacunas son eficaces, son seguras y es la mejor arma que tenemos para defendernos contra el COVID-19. En el condado de Santa Clara llevamos al menos el 80% de las personas quienes ya recibieron al menos su primera dosis de la vacuna y aproximadamente el 71% está ya completamente vacunadas. El anuncio de hoy lo que quiere decir es que la orden de salud del 18 de mayo, la cual requiere que todas las empresas y entidades gubernamentales del condado de Santa Clara determinen el estado de vacunación de su personal, por ejemplo, por medio de una simple autocertificación, esta orden ya no es válida después del día de hoy. Y esto es siempre y cuando los negocios ya hayan hecho dos veces preguntado el estatus de vacunación de sus empleados. La primera se tuvo que haber realizado para el 1 de junio y la segunda 14 días después, es decir, después del 14 de junio o el 15 de junio. Para aquellas empresas quienes ya cumplieron con estos requisitos y tienen documentada esta información, ya no hay nada más que hacer, solamente guardar y mantener toda esa información a salvo para que en un lugar seguro, para que también puedan tener, estén también en relación con Cal OSHA y puedan mantener esa documentación la cual es requerida por el Estado. También lo que sabemos es que tenemos al menos cerca del 30% de la población quienes no están completamente vacunados aquí en el condado de Santa Clara. Y lo que le queremos comunicar a este grupo de personas que aún no están completamente vacunadas es que se necesita las 2 dosis de la vacuna para ser considerados completamente vacunados. También, si aún no se han puesto la vacuna, tenemos más de 200 lugares de vacunación en el condado de Santa Clara, incluyendo lugares de farmacias locales, clínicas comunitarias, donde la gente puede ir para ponerse la vacuna completamente gratis, no afecta su estatus migratorio. Y lo estamos llevando también a todo una van para poner vacunas en eventos especiales para asegurarnos que la gente tenga acceso a la vacuna. También toda esta información estará disponible en nuestro sitio web. También pueden visitar nuestro sitio para ver cuál es el sitio más cercano hacia ustedes, el cual es el sccvacuna.org, o también pueden llamar al 211 para encontrar un sitio de vacunación cercano a ustedes. Gracias. We will now go ahead and move into the Vietnamese portion of this press conference. Thank you.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay quận hạt Santa Clara đã mở một buổi họp báo để đưa đến cho quý vị thông tin về những quy định đeo khăn che mặt tại nơi làm việc. Kính thưa quý vị, bác sĩ Sara Cody, giám đốc Sở Y tế hạt Santa Clara, thông báo loại bỏ lệnh địa phương được ban hành ngày 18 tháng 5. Các quy định mới về nơi làm việc của Cal OSHA được tạm dịch là Bộ Lao động Tiểu bang California, Văn phòng phụ trách sức khỏe và tại nơi làm việc không yêu cầu những nhân viên đã được tiêm ngừa đầy đủ phải đeo khăn che mặt tại nơi làm việc nữa. Điều này có nghĩa là tiêm ngừa là cách tốt nhất để quý vị có thể bảo đảm sức khỏe cho chính quý vị, gia đình và cộng đồng. Thuốc ngừa hiện tại được FDA phê duyệt sẽ có hiệu quả để chống lại các biến thể đang hoành hành ở trong cộng đồng của chúng ta. Theo các quy định mới của Cal OSHA thì một nhân viên được coi là đã được tiêm ngừa đầy đủ là sau khi mà nhân viên này đã được tiêm ngừa sau 2 tuần của cái mũi thứ 2 của thuốc Pfizer hoặc là Moderna, hoặc là một mũi của Johnson & Johnson, và các chủ doanh nghiệp phải có các giấy tờ chứng minh các nhân viên này đã được tiêm ngừa đầy đủ trong vòng 14 ngày. Lệnh y tế địa phương ngày 18 tháng 5 vẫn yêu cầu tất cả các doanh nghiệp và tổ chức chính phủ ở hạt Santa Clara là xác định tình trạng tiêm ngừa của nhân viên của mình. Các chủ doanh nghiệp không cần phải báo cáo thông tin này đến quận hạt Santa Clara. Tuy nhiên, quý vị phải có một nơi để lưu trữ những cái thông tin này của nhân viên. Khi mà các viên chức thực thi lệnh của Sở Y tế mà đến thăm các doanh nghiệp của quý vị thì quý vị phải có những cái chứng minh để đưa ra cho các viên chức thực thi này. Theo lệnh hôm nay thì lệnh y tế địa phương ngày 18 tháng 5 sẽ bị hủy bỏ, ngoại trừ những doanh nghiệp hoặc là tổ chức chính phủ chưa có những cái giấy tờ xác nhận vòng thứ 2 của các nhân viên của mình. Như quý vị cũng biết thì cái vòng thứ nhất xác định tình trạng tiêm ngừa của nhân viên là vào ngày 1 tháng 6. Thì sau 14 ngày, có nghĩa là ngày 14 hoặc là 15 tháng 6 là quý vị phải xác định cái tình trạng tiêm ngừa lần thứ 2 của nhân viên của mình. Những cái người mà chưa báo cáo cái tình trạng tiêm ngừa của họ, hoặc là những cái người mà đã báo cáo là họ đã tiêm ngừa rồi nhưng mà chưa được tiêm ngừa đầy đủ, thì quý vị phải xác định vòng thứ 2. Thì sau khi mà quý vị xác định cái vòng thứ 2 rồi đó, thì quý vị có thể nói với những cái nhân viên của mình là các nhân viên không cần phải đeo khăn che mặt khi đến nơi làm việc nữa. Tất cả các tổ chức chính phủ và các tổ chức doanh nghiệp cũng phải duy trì các cái hồ sơ này trong cái quá trình mà CAO OSHA vẫn còn đang làm việc và có cái đang thực thi cái lệnh này, thì quý vị phải lưu trữ cái hồ sơ của nhân viên của mình. Và lưu trữ bằng cách nào thì quý vị cũng có thể đi vào cái trang mạng của CAO OSHA để có thể tìm hiểu thêm. Thêm vào đó thì lệnh của ngày hôm nay cũng tiếp tục khuyên là quý vị nếu như mà chưa đi chủng ngừa thì hãy đi tiêm ngừa sớm nhất có thể. Tiếp tục giống như là mình phải xem xét các hoạt động ngoài trời, những hoạt động nào mà an toàn thì mới thực hiện và tùy theo điều kiện sức khỏe của mỗi người. Tránh đi du lịch nếu như mà mình chưa được tiêm ngừa đầy đủ, và tiếp tục thường xuyên giống như là mình phải đi xét nghiệm COVID-19 nếu như mà mình đi du lịch xa hoặc là khi mà mình trở về. Theo quy định của tiểu bang thì tất cả mọi người đều phải mang khăn che mặt dù đã được tiêm ngừa hay chưa khi họ ở trong các cơ sở chăm sóc sức khỏe, tại các trường học, nơi giữ trẻ, các cơ sở của thanh thiếu niên, trên các phương tiện giao thông công cộng như là đi máy bay, đi xe bus hoặc là đi tàu điện, trong các nhà tù, các cơ sở cải huấn và tại những nơi trú ẩn khẩn cấp và những cái nơi mà có người vô gia cư ở thì quý vị vẫn phải mang khăn che mặt nha quý vị. Và theo như CDC thì quận hạt Santa Clara là một trong những quận hạt có tỷ lệ tiêm ngừa cao nhất nước Mỹ, và cho tính đến thời điểm ngày hôm nay thì có 80% cư dân từ 12 tuổi trở lên là đã được tiêm ngừa ít nhất là một liều vaccine COVID-19, và đã có 71% những ai từ 12 tuổi trở lên là đã được tiêm ngừa đầy đủ. Nếu như mà quý vị muốn biết thêm thông tin về việc tiêm ngừa cũng như là các địa điểm tiêm ngừa, đặt hẹn cũng như là các địa điểm không cần lấy hẹn thì quý vị có thể tìm các thông tin này trên trang mạng của quận hạt Santa Clara là scc.freevax.org, hoặc là quý vị cũng có thể gọi vào cái đường dây hỗ trợ tiêm ngừa của quận hạt Santa Clara, làm việc 7 ngày trong tuần từ 8 giờ sáng cho tới 5 giờ chiều, là vào số 408 970 2999, 408 970 2999. Xin cảm ơn quý vị. And now we will move to Chinese statement.
大家好，我是圣塔克拉拉县紧急行动中心的 Anchen， 在此为您提供新冠疫情的更新。有鉴于加州职业安全与健康管理局 OSHA 最新通过的规定，圣塔克拉拉县卫生局长 Cody 博士宣布逐步停止2021年5月18日的地方卫生命令，在其他措施配合能够确保疫苗有效以及安全性的情况下， OSHA 已经不要求完全接种疫苗的人在工作场合里面戴面罩。根据 OSHA 的定义，完全接种疫苗者是雇主有文件能够证明此雇员在至少14天前打完了2剂系列疫苗的第2剂，像是辉瑞或是莫德纳。5月18日的卫生局长命令要求所有在圣县的企业和政府的实体确认其工作人员的疫苗接种状况。根据今天的命令，5月18日的卫生命令将被撤销，但是企业和政府实体必须完成其人员的疫苗接种状况报告。今天的命令包括了鼓励大众接种疫苗来保护社区的安全，继续的鼓励在户外活动，还有尚未完全接种疫苗者尽量不要出行，并且呢要经常性的做新冠肺炎的检测。而根据加州的规定，在以下的场合，不管疫苗接种与否，都必须戴面罩，包括在医疗保健的环境下，在学校、托儿和有青少年的场所，在搭乘公共运输时，在监狱和无家可归以及紧急庇护所内。想要了解疫苗的讯息还有疫苗站的地点，请上圣县的疫苗网站 scc.freevax.org。 更多新冠的消息与更新，请上圣县的网站 www.scc.gov.org/covid19。 最后祝大家平安健康。 Now we're moving into the Tagalog statement. Thank you.
Magandang umaga po. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer ng County ng Santa Clara. Tinatanggal ang May 18 na kautusan ng pampublikong pangkalusugan ng county dahil sa mga bagong regulasyon sa lugar ng trabaho sa COVID-19 ng CAL, OSHA at ang laganap na pagbabakuna. Dahil sa bagong ipinapatupad ng mga regulasyon sa lugar ng trabaho, nag-anunsyo ang California Department of Industrial Relations, Division of Occupational Safety and Health, kilala bilang CAL OSHA, Dr. Sara Cody, Health Officer at Director of Public Health para sa County ng Santa Clara, ng pagtanggal ng May 18, 2021 na lokal na kautusan sa pangkalusugan. Ang bagong mga regulasyon sa lugar ng trabaho ng CAL OSHA ay hindi nangangailangan sa mga manggagawa na ganap na nabakunahan na magsuot ng mga panakip sa mukha, kasama sa iba pang mga pagbabago na nagpapakita ng pagiging epektibo at ibinibigay na kaligtasan ng pagbabakuna. Sa ilalim ng bagong mga regulasyon ng CAL OSHA, ang isang empleyado ay itinuturing na ganap na nabakunahan kung ang employer ay may dokumentasyon na nagpapakita na ang empleyado ay nakakumpleto ng kanilang serya ng pagbabakuna na hindi bababa sa nakaraang 14 na araw. Halimbawa, 14 na araw pagkatapos ng pangalawang dosis ng bakuna ng Pfizer o Moderna. Sa ilalim ng mga panuntunan ng Estado, ang mga panakip sa mukha ay kailangan pa rin, hindi alintana ang katayuan ng pagbabakuna. Kailangan ito sa mga lugar ng healthcare, sa mga paaralan, childcare at mga lugar ng kabataan, sa mga public transit, sa mga kulungan at correctional facility, at sa mga homeless at emergency shelter. Para sa karagdagang impormasyon, mangyaring bumisita sa website ng county sa www.sccgov.org/coronavirus. Maraming salamat po.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.